Now let's talk about behavioral or social learning therapy. This is a different type of therapy. Again, what we're trying to do is be able to treat people who have abnormal or personality disorders. The assumption with the behavioral disorders is that you have learned inappropriate behavior. Therefore, by using different operant conditioning techniques, you can relearn appropriate behavior. So the thing to remember about the behavioral therapies is that it's not where you're talking somebody through something. It's not using medication. It's not assuming that there's anything physiological that's causing the problems. The problem is that you learned inappropriate behavior. So, for example, OCD. Someone is compulsively washing their hands, or they walk 3 steps and stop, and then walk 3 more steps and stop, and walk 3 steps and stop. Those are abnormal behaviors, and their belief is that they have been learned inappropriately. So let's talk about how do you try and treat these people. Well, again, you use operant conditioning techniques. For one, contingency contracting. If you ever had an allowance when you were growing up, that's the same thing, contingency contracting. You are setting up a contract. For example, a therapist would set up a contract with the patient or the client. And again, it's kind of like an allowance. If your parents ever said, as long as you make your bed every day, clean your room once a week, and wash the dishes 3 or 4 times a week, then we will give you X number of dollars as an allowance. Well, that's the same thing in contingency contract. The therapist would set up some kind of a reward system and tell the client that, okay, as long as you can do this, this, and this throughout the week, well, then you're going to earn this kind of a privilege or this kind of a reward. Token economy. Token economy you see a lot in, for example, elementary schools. Chuck E. Cheese is based on token economies. It's where instead of getting a reward every single time you do something, you get a token if you do something correctly. So a third grade teacher gives stars to people each day, to some of her students each day when they're good. They've had good behavior all day. Well, they may earn a star. And then after they've earned 20 stars, they can trade in the 20 stars for some kind of a reward. And again, that's a token economy. Chuck E. Cheese does it with the little tickets that you earn by playing the game. And, you end up with 2 billion tickets and you earn a slinky. So that's a token economy. Aversive conditioning, or aversive therapy, is conditioning through the use of pain or punishment. So this would be where somebody gets punished for doing incorrect behavior. Now, the difficulty with that is aversive conditioning can lead to bad feelings or harsh feelings from the person who's being punished, obviously. Systematic desensitization and implosive therapy. Those are 2 different ways of trying to get across the same thing or do the same thing. These tend to be used when people have some sort of a fear, an irrational fear or phobia of something. Systematic desensitization. If we break that word down, okay, if I said I was sensitive to snakes, that would mean that I was afraid of snakes, or I didn't feel comfortable around snakes. Well, if I desensitize that, what I'm doing is I'm removing that fear or that anxiety. Now, when we add systematic, that means that there's a system to it, there's a procedure to it. So let's say that I'm afraid of snakes. Step number one is they teach me to totally relax, feel totally at ease. Once I'm relaxed and at ease, they might show me the word snake on a poster board when I'm across the room from it. I maybe tense up, but then eventually they treat me or they get me to relax again. Then they show me something else. They show me a picture of a snake on a poster board that again is across the room. I tense up, they go through the relaxation process, and I get to relax. This is all based on the idea that you cannot be relaxed and at ease and yet sensitive or fearful at the same time. You can't be those two things at once. So you go through that and you continually, it's almost like shaping, you continually get closer and closer to that feared object. The idea is eventually, if I was afraid of snakes, well then eventually they would get it to the point where they could actually have me holding a snake and it wouldn't bother me. Implosive therapy is also trying to remove a fear or an anxiety, but you do it in a totally different way. If you've ever seen them on TV do what's called imploding a building that they're going to destroy, they cause the building to kind of collapse from within, and essentially it all comes down in a pile of rubble. Well, that's the same type of thing when you're trying to get rid of a fear or an anxiety. Implosive therapy, an example, if someone were afraid of water, you might get them and throw them into a 3-foot pool. Now, they're going to be scared to death, terrified, anxiety out the roof for a time period. And so essentially they're imploding their behavior. I mean, they literally are overwhelmed with anxiety. But eventually they learn that there's nothing really to be afraid of. If they just simply stand up, they're in 3 foot of water, there's nothing going wrong, there's nothing to be afraid of. And at least the idea here is that after that 5 or 10 minutes of sheer pandemonium and extreme anxiety, they're going to finally get to the point where they realize, wow, there's nothing to be afraid of. I have nothing to fear. So those are all different types of behavioral therapies. Any type of operant conditioning technique could be used for behavioral therapies. Now, so far we've talked about medical therapy, we talked about psychotherapies or talking therapies. Now we've talked about behavioral therapies. One thing I want to make clear, the final thing here, is that most therapists, most psychologists today are not bound by one particular type of therapy. For example, if you go to a therapist, they're probably not going to say, well, I'm a behavioral therapist and that's all I do. They are going to use whatever treatment they think will best suit the scenario, any particular patient. So that is called an eclectic approach. An eclectic approach, again, it's when a therapist will use whatever they think will help that particular patient at that point in time. So if they think that the person needs medication to maybe level out their moods or take away some anxiety, they'll put them on medication. If they think they need to do some type of a behavioral conditioning type deal, they'll do that. If they need to sit down and talk to them for an hour, they'll do that. They'll do whatever is absolutely necessary. Those are all different types of therapeutic approaches.